Dr. Ursula Worsham is the Assistant Dean and Diversity Officer for the UCI School of Medicine and Associate Director for Equity, Diversity, and Inclusion for the UCI Chow Family Comprehensive Cancer Center. Collaboratively, Dr. Worsham is charged with leading strategic initiatives to advance diversity, health equity, and inclusive practices across the UCI health enterprise. She is an assistant adjunct professor in the Department of Family Medicine and is responsible for leading the creation of the UCI School of Medicine's Office of Belonging, Equity, and Empowerment to support a community where all can thrive. Dr. Worsham holds a doctorate in education from the University of Southern California, as well as a bachelor's and a master's degree in counseling and health science from California State University, Long Beach. With that said, Dr. Worsham, take it away.
Thank you so much for that kind introduction, and a sincere thank you to all that are taking out of their busy days to learn a little bit about the policy that we have at UCI Health on management of patients' discriminatory behavior. This effort came out of a project called No Offense, and it was led by work within the Department of Family Medicine. And so we're just so thankful for the opportunity for the New Mexico Primary Care Training Consortium for prioritizing this content and for the opportunity to share this information with you today. Before I begin, I want to quickly kind of acknowledge that there was support that initiated this effort, and that came out of our own Office of Inclusive Excellence. The Promote Thriving project was led by Professor Emerita Dr. Cynthia Hawk and a host of contributors that we see highlighted here. Additionally, just kind of as a reference to some of the content that we'll be covering, we will have two scenarios that may be triggering if you've experienced discriminatory behavior in the past. And so I invite you to take care of yourself during this learning experience. In terms of our time together, here are the learning objectives, which include a review of our policy on the management of patients' discriminatory behavior, as well as we invite you to participate in an opportunity for us to practice respectful responses to this type of behavior should it occur. And then also towards the end, we'll have an opportunity to discuss the benefits and the costs perhaps of establishing or beginning conversations of how such a policy or efforts can support the work that you do in each and every day within your own respective health system. So we'll start with kind of an overview of the purpose of the policy. I think at its core, we all understand the rationale behind having a policy that supports the mitigation of this type of behavior. But I want to highlight how we frame this in terms of the work that we've done at UCI Health. So first, at its core, it really was designed to guide an appropriate response in both action and communication to discriminatory and or harassing conduct towards all UCI Health personnel. And so you can see here as highlighted, it really was, when we say UCI Health personnel, it was encapsulating not only our trainees, our learners, volunteers, our faculty, as well as our staff. I'm talking to the choir in terms of it takes a village in terms of doing the work that we do every day in patient care. And so it was important that whatever policy was put in place, that it was holistic and it provided support for everyone who's involved in the experience in terms of patient care. Also, this policy provides guidelines on how to address discriminatory-based personnel reassignments and requests by patients as well, which we found was showing up in some of our previous reports related to discriminatory behavior. Next, we'll kind of provide a high-level overview on our actual policy itself. We have that policy that will be available in case folks want to be able to reference the policy that was created at UCI Health, and that can be provided by the organization following the presentation as well. So here we see kind of an overview of the policy. The policy highlights the expectation for all UCI Health patients and their families to respect the rights of other patients, visitors, and staff from threats, violence, disrespectful communication, harassment, or discrimination for any reason, including their protected status. So you may be wondering, okay, what is protected status and what does that encapsulate? And then here, before we move on to that definition, I just want to highlight the fact that when we say including because of any individual's protected status, it will not be tolerated. So no acts of discriminatory behavior that you see highlighted here will be tolerated within our academic medicine space. Here, highlighting just kind of the last aspects of the policy that focus on the ultimate goal of fostering a safe and productive work and learning environment that's free from discrimination and harassment per the policy. Once again, highlighting the next slide, which will identify what those protected classes are. Here we see as reference the definitions in terms of protected class refers to an identity protected by California law, including but not limited to. And then the key here, of course, is California law because we are housed in California, and that may be different depending on the state, of course, that you are practicing in. But for us, those key components included ensuring that we covered race and ethnicity, religion, not only gender, but gender identity and or expression, physical or mental disability, dress or physical appearance, as well as national origin and or citizenship. Additionally, as part of implementation efforts for no offense, we recognized that we needed to do training for that. And so we engaged in no offense training. We sought the support of Pure Praxis. They provide in-person training that allows for individuals to act out various scenarios to then utilize the policy in terms of responses that they would use as part of those provided scenarios. So we also provided pre and post testing. Essentially, we wanted to identify those that were participating, what was their understanding of the policy prior to coming to the training, and their comfort level in utilizing the policy, and what that may look like after they had a training, but also kind of greater awareness and had an opportunity to ask questions about the policy. What did they feel in terms of those experiences or the policy post-training? We offered 9 interactive live training sessions. We had over 400 participants with really the following goals in mind. We wanted to make sure that we outlined expectations, as we mentioned previously in highlighting the policy, that this behavior will not be tolerated for all involved. 2, we wanted to also ensure that we were letting all of our community know that they could be empowered in terms of this policy, in terms of the work that they do, whether they are providing patient care or working with patients and their loved ones or visitors that may come to the hospital, and that we really wanted to reinforce the overarching goal of this policy, in addition to, of course, providing a mechanism of which to communicate about discriminatory behavior and have a response, but also to make sure that we're promoting thriving for our entire community. So that included, we had administrators, we had medical students, we had residents, we had fellows. So it really was very diverse in terms of individuals who attended the training. And it really was wonderful to see how this training has continued and has grown in terms of those initial 400 participants. Additionally, as a result of the no offense policy impact, we of course work very closely with the UCI Office of Equal Opportunity and Diversity. And a quote that came from the individual who oversees this department really kind of highlighted the impact of the policy has had in terms of interactions with patients and their loved ones in the clinical space. Here we see highlighted that they said that they handled over 100 cases just in fiscal year 2023 alone, where a patient was alleged to have engaged in discriminatory conduct. The policy since then seems to be effective in providing a framework, once again, not only to identifying when this behavior is not appropriate beyond the individual's experience, but also having support in terms of how do I respond once I find myself in this situation in the clinical space. We also found that this policy had an impact in terms of our residents. Our residents became much more empowered and engaged and really wanted to take an opportunity to lead some of the efforts and interventions at the resident level and fellow level to make and contribute to the difference that we were seeing within our clinical spaces. We saw incidences where our residents were leading workshops in how to navigate offensive patient interactions. We also saw additional training that supported education and guidelines to support residents who may have had a particular encounter, helping them navigate how do they leave the room, engage with leadership, and seek support in terms of how to engage in a debrief and perhaps navigate through challenging patient interactions. We also saw additional increases in confidence of individuals creating reporting that related to the various incidences, and then, of course, reaching out to patients to discuss appropriate clinical policies and make them aware of the type of community and culture that we're fostering within UCI Health, and how that was important to ensuring that we were providing adequate care, and then also ensuring that everyone felt comfortable and respected within our clinical spaces. Additional safety procedures, of course, were highlighted in terms of this effort, but what was at the core of this behavior really was the fact that we were reinforcing with our residents that their interventions were supported at a high level with institution-wide policy. So it wasn't a case-by-case situation in terms of when the policy could be used or not used. It was a blanket policy that everyone could use as a framework and a guide in terms of ensuring that they felt safe, respected, and that they can do the work that they've been tasked to do in terms of patient care. And so in terms of our policy, what I'd like to do now is kind of shift to a scenario. And I want you to know that this, of course, is a scenario that involved pure praxis. And so we had actors who were providing the scenario for us. So no patients were harmed in the recording of this video. But I would hope that if you haven't yet found yourself in a situation where you yourself have experienced discriminatory or harassing behavior within the clinical space, and I hope that hasn't been the case. But if it has, once again, we want you to take care of yourself if this is triggering. If you have not, perhaps this can give you a framework and or a guide or an opportunity to think about, if I found myself in this space, in clinical space, and in hearing this scenario, and this happened to me, how would I navigate this as a resident or a fellow or an attending physician? So we are going to go to our first of our two scenarios. And after the scenario, you will have a chance to debrief and ask any questions or perhaps share how you would respond. And then per the policy, we actually have some recommendations of how you could respond to the scenario if you perhaps need a little bit of practice in terms of how to respond in situations like this. So we'll start with scenario number one.
I'm sorry again about the wait. It's been a busy day.
I totally get it. I'm just glad everything came out all right.
Thank you for understanding. So I guess I'm good to kick you out of here now.
Oh, that's it? I thought I was going to be seeing a doctor.
You did. You spoke with Dr. Corpus, the white coat who came in and introduced himself a few minutes ago?
The one with the accent? They're a doctor?
As much of a doctor as you can be.
So they learned to be a doctor here in the States, or where are they from?
I can assure you that everyone who works for UCI Health meets the same standard of education and training.
I'm sorry, I don't mean to be the difficult patient. Would it be possible to get a second opinion? Do you have a doctor from here that I could speak with?
Okay, so that was our first scenario. I invite you to take a breath and exhale if that triggered you in any way. And hopefully you have not experienced this type of situation, but if you have or experienced something parallel, I challenged our group to think about that comment that was made by the patient. Do you have a doctor from here that I can speak with? And so, of course, the term here in quotes is very loaded in terms of this particular experience. So I'm curious, A, what are your initial thoughts from the scenario number one? And two, who would like to share how would they respond? And feel free to come off of mute share your name and share your thoughts.
My name is Lim, and I'm a family medicine applicant, in fact, and I had the experience of 1 year visiting scholar in the UCI in 2019, and so I have an experience of such kind of scenario one, and I'm working as a senior student in the New York Brooklyn in the internal clinic, and they requested such kind of request of doctors from more senior doctors or more familiar doctor who is very familiar and previously practiced with the patient and their family, and they requested ask nicely, and requested such kind of give me an order, doctor from here or more familiar doctor to them. And in fact, my situation is in fact a minor at every situation. So my action was previously, I practiced their order, given the order, and notified to my senior, and the doctors came, and started their practices. That is my experiences. Thank you.
Yeah, no, thank you. Thank you so much for sharing. And I'd love to kind of create a parallel here when we talk about such comments that may have included some aspects of bias that, we have to separate intent from impact, right? The intent could have been wanting to ensure that they had someone, physician caring for them that had a certain level of experience. But that doesn't take away the fact that that comment may have had an impact to you in terms of how you perceive that request. So I assume that that probably didn't feel great in the moment. Am I correct?
Yes, correct. Thank you.
Yes, yes. So we have to be mindful that even though that ultimately that request was, taken care of in terms of bringing in maybe a senior physician, it kind of somewhat minimized your capacity to be able to demonstrate your capabilities. So I really appreciate you sharing that with the group in terms of your experience. Are there others who would like to share? Okay, so here, let me just highlight per our policy some additional ways that we encourage individuals to respond in such situations. What we want to keep in mind is that this work is truly intentional, and each of us may be at a different place in terms of our responses due to our lived experiences, our professional experiences, and perhaps the intersectionality of our various identities. And so we intentionally built into the policy examples of responses that can be used to mitigate discrimination and or discriminatory behavior. And so some examples include, help me understand your comment, right? So coming from a place of curiosity as opposed to accusation, even though internally you may be in defense mode and wanting to, come from an accusatory response, but the goal is really to help move the conversation forward, to gather more information in the moment as you feel comfortable. So that could be one way to address the particular behavior. It also could be that, words or comments such as that can be viewed as offensive. I ask that you not use that particular word or comment again. It could be a way to respond. Or once again, we of course are referencing UCI Health here, but it could be, one of X institution core principles is to treat everyone with respect and dignity. We do not tolerate disrespectful or offensive comments and or behavior. So once again, you reinforce the type of community that you want to create. You also reinforce what will not be tolerated, and you try to come to a solution of how you want this interaction to move forward. And in some instances, we are able to honor certain requests that, once again, as was shared, a senior physician was able to come in and to provide the care with specific rationale. But in other instances, there may not be an opportunity to replace the physician based on what the request is. And we do have, per our policy, some instances where those requests cannot be honored and simply cannot be honored due to those protected classes that we highlighted earlier in the policy, because someone has a preference in terms of who is catering to them. Any other thoughts related to scenario number 1, the application, and or some of the responses that you see listed? Okay, let's move on to scenario number 2.
I'm sorry again about the wait. It's been a busy day here. So, I'm sorry. Go ahead. Did you have a question?
Yes, I don't mean to be difficult, but before you discharge me, could I speak with another doctor?
Okay. Do you mind if I ask if you had an issue with Dr. Corpus?
Well, I would appreciate if I could speak to an American doctor, someone whose education I can trust.
Well, I can assure you Dr. Corpus has met the same standard of training and education as any other doctor in this hospital.
As the patient, I think I'm entitled to choose the quality of the healthcare I receive. So I need you to either get me another doctor, or I want to speak with the charge nurse, because clearly you're defending your own kind.
Okay. That was the end of scenario number 2. Once again, I invite you to take a deep breath if that was triggering for you. And I want you to, similar to scenario number 1, think about what was discussed in scenario number 2. So the patient is feeling entitled, and that statement related to, I'm entitled to choose the quality of my healthcare. So I need you to get me another doctor. So once again, here we see an underlying bias, assuming that because perhaps someone has an accent, or they assume that they weren't trained here in the United States, that the quality of care is going to be different. So think about how you may respond to scenario number 2 as opposed to 1, and feel free once again to come off of mute and share your thoughts related to this scenario. What thoughts do you have?
I just wanted to chime in real quick. I'm not a doctor, but I worked front office for a residency program for a long time. And so this was like one of our biggest issues is, all this that we're talking about. And it was so hard to, before they made their first appointment, we'd explain to them it's a residency program, and explain the program. And they would come in and they would leave wanting to either speak to the manager, speak to another doctor. But we really didn't have training on how to respond for that. So this is like really good. I would just always go to the preceptor and let them know what was going on and tell them, how this patient, complaining, for the situation. And then from there, we would either, the preceptor would talk to them or, but it was really hard because it was kind of always, the patient's always right. So you got to give them their way. That's kind of like the hardest part of doing that.
Absolutely. Thank you so much for sharing that. And I can only imagine how challenging that was to navigate all those different requests that were, warranted or not warranted otherwise. And so you really hit on a very important point, is like, how do you respond? And then how do you balance that framing between the patient and their needs and wanting to support the requests of the patient, between creating a culture and community where everyone's voice is important and is valued. And so that's why, in terms of this policy, anything related to patients' discriminatory behavior and or harassment, it really does have to come from a leadership and or institutional level to ensure that it's embedded into the culture, the climate, and the expectations of what will be and what will not be tolerated, irregardless of the patient's requests. Once again, ultimately, our goal is to do no harm to patients, ensure that patients are safe. And to do that, we need to make sure that everyone is in a situation where every voice is heard, everyone can thrive, everyone is respected, to ensure that we can drive those ultimate goals of excellent patient care and quality. So thank you for sharing that. Any other thoughts on how you would respond to scenario number 2?
Hi, my name is Dr. Jessica Allen. I work at Shiprock at the Indian Health Services Hospital. I think sorry, I don't have less of a example of how I might respond, but more of just a reflection on the language used in some of the examples that you gave as responses for last time. And it's really helpful for me to have that kind of modeling. However, I find it when I've tried to do the very stern, we ask you not to do that, we don't tolerate that. It kind of puts the patient on the defensive, and also I don't find that I tend to be a very stern person, so I have trouble kind of I guess being that stern person. Do you have any thoughts or comments on that?
Yeah, thank you so much. And I appreciate you being vulnerable and kind of sharing your own perspective. And this is definitely, once again, to reinforce this behavior does not come natural to us. It is something that we have to learn and we have to practice over time, which is why we provide various types of scenarios. But of course, they can be flexible. But I would say oftentimes in terms of de-escalating any type of interaction, especially around issues related to discriminatory behavior, oftentimes the first step is to ensure that we create spaces, where an individual can be heard, right? So creating a space where, we start from a place of curiosity. Can you tell me a little bit more about that or your request? I hear you. I'd like to gather a little bit more information to make sure that I understand what you're asking for, or what your request is for, or perhaps come up with a solution of how we can move forward. So some people are going to be more comfortable based on perhaps time and experience in terms of coming in with, the what we do not tolerate or accept. And then others, as we're kind of starting out new in this process, can really, once again, come from more of a place of curiosity. Like, I may not necessarily agree with that, but I'd like to learn more about what it is that you want to say or share. Or once again, how do we get to a better understanding of how we move forward? And then there could be an opportunity as you gather more information to then insert, here's what we can do. Here's what we are not going to be able to do. And so ensuring that someone is heard really does go a long way in many interactions, especially when it comes to discriminatory behavior. So I really appreciate that question.
Yeah, and ensuring they're heard makes them de-escalate. And I think the other reflection I had on the way that it was more so handled by the employee in the video was seems like he was taking an educational route where he was explaining that the provider that she saw had the same qualifications and up to standards and things like that. And she didn't really seem to respond to that though, I guess, in the video. So I think I'd be like, I don't know what to do about that.
Absolutely, absolutely. It was a good starting point, but you may find that every interaction is different. So then it could be an opportunity once you stated that to then go and seek some additional support from leadership to say, here's the interaction, here's what I've already shared. Perhaps I can get your support in terms of what do I do next? And that's okay too. I mean, our healthcare spaces are designed to be collaborative, team oriented, so we can work together even in situations that are challenging like this. So great thinking on your feet. And then are there any other thoughts or perspectives on perhaps how you would respond before I share some of the examples and ways that we put into the policy that our team members can respond? Okay, so let's move on to some ways that we highlight that in the policy, as well as perhaps you heard some of this language in this scenario number 2. So once again, help me understand your requests, right? So Jessica, this kind of refers to your framing in terms of, creating an opportunity where we can once again ensure that someone is heard and that we create space for coming from a place of curiosity and wanting to understand and do our best to minimize our own personal desires to be defensive or upset about something that perhaps felt like an impact to us, because it likely was an impact to us. So we may need to separate the interaction from our own individual processing time. Here, we also highlight ways that we can say, once again, we're here to help you as a team, right? So kind of taking it yourself out of being the individual under attack and say, we're really here as a team, as a unit, as an organization to help you. We don't change our doctors, our nurses, et cetera, because of their race, ethnicity, religion, et cetera, or any other types of protected classes per our policy. As we heard in the response, all of our team members are qualified. Our top priority is that you receive the best care. And I know that our team members can help provide that in terms of the patient interaction. And then the last response that you can see here, once again, also kind of honors that same thing of what we can do, what we're not able to do, and then reinforcing that our goal is to give you the best care. And I would hope that as patients come in, this isn't always the case. We've, of course, heard scenarios where patients come in and they're thinking even beyond their own care and well-being to have something different than perhaps what they see presenting in front of them. But we have to kind of be as firm as we can in terms of honoring our respective policies, but once again, reinforcing that everyone is here to help provide you with exceptional care. We're part of a team, and our goal is to make sure that we take care of you and protect you as a patient. So just a few additional responses that could be used. And once again, the goal is for these to start as a framing, a starting point, and then as collective and individual teams, we can add to these type of responses in a way that individuals can kind of practice, get comfortable with. And then you may find as you start to respond more to these type of situations, you start to create your own toolkit of things that you say and how you would say it and how you would kind of protect yourself, but also have responses that could be used based on your own level of comfort. So any thoughts here in terms of additional responses, or do you find these extra responses helpful as well? Okay.
I find those helpful, especially if you do have a policy backing it up. And I'm not, yeah. So I think that's important.
Yeah, indeed, indeed. And I appreciate that reference to having a policy to kind of back things up. And even if, as an organization, the policy isn't quite yet created or is in process, there could be like standards of care or kind of community guidelines that can be shared within a department that would give team members an opportunity to kind of refer back to in terms of these conversations as well. So we recognize that it took us a long time to get to this policy. This didn't happen until 2022. And so, it wasn't like our community had something to refer to prior to that time frame. So this really is an opportunity to kind of move forward, being mindful of kind of the increase in experiences that our clinicians were having in the healthcare space, giving them a resource and a guide in which to kind of know that they had support in terms of their service to patient care.
And I'm going to apologize because I did come in a little bit late. And I know this is supposed to be meant to be more of a discussion. But did you have examples of resources and examples of policies that you could direct us to or share? And that's also something you could just address at the end of the talk if you want.
Yeah, Absolutely. So what we did at the beginning of the presentation is kind of highlight the overarching policy, the goal of the
Uh-huh.
policy, as well as the various protected classes per California law that we are
Mhm.
addressing the policy. But the
Okay.
actual entire policy was provided to the consortium. And so that can be provided to anyone who's participating today, as well as you will get access to the slides that you can refer back to as needed. So.
Oh, thank you. I'll ask Mario to email me.
Okay, perfect, perfect. Yeah, yeah. This really is designed to kind of be a starting point for future conversations, because it's as disheartening as it was to hear in our own clinical space what some of our physicians, residents, and fellows were experiencing. It's equally as disheartening to hear your individual shares that you have today in terms of how you're navigating through the fact that you have to not only provide care, but you have to provide administrative support, patient care, and many other aspects of the healthcare experience. And then you're dealing with these type of impacts to your own personal well-being related to discriminatory behavior. So it really is important for everyone. We all deserve to work in environments where we can thrive and that we feel respected, we feel valued. And if that isn't the case, it needs to be a priority for all organizations. So I'm not picking on the consortium nor UCI Health. It's something that I think all organizations owe to the environment in terms of increased cultural humility, cultural awareness, as well as opportunities for everyone to thrive. So great questions and great feedback.
Thank you.
Okay. I just want to say once again, thank you to the consortium for having me. It really has been an honor to spend my time with you, and I appreciate them prioritizing this content. I look forward to serving as a thought partner should anyone have any questions in the future. And I just want to thank you for the work that you're doing. Stay encouraged. I know it's challenging sometimes when we're working with limited resources, limited staffing, and still navigating through these circumstances, but it's important to create safe spaces where you can talk, communicate, get support so that we can get up the next day and do the same thing and be better. Thank you.
Thank you.
All right. Thank you, Dr. Worsham, for that great presentation. Thank you all very much. Have a great rest of your day and have a great holiday season.